Hamlin's on-field collapse and subsequent recovery has brought increased attention to heart conditions. This is something one doctor in Pueblo has been concerned about for young athletes for years. Dr. Rocky Khosla was watching the game when Buffalo's Damar Hamlin collapsed on Monday, and he immediately worried it could be a deadly condition called ventricular fibrillation.
And I was thinking, oh my God, I hope that's not the case, and I hope there's a defibrillator.
Cardiac episodes in sports are rare compared to other injuries, but when they happen, they can be fatal.
The drop in survival rate is 7 to 10% per minute.
A study published in 2013 found that sudden cardiac arrest was the leading cause of death in high school and college football players.
So the leading cause of sudden cardiac arrest in the active athletic population under 35 is a thing called hypertrophic cardiomyopathy. Fancy words, we call it HCM. It's basically the heart muscle thickens in the middle. Electrically, it's abnormal, and at any point it can throw bad arrhythmias. Ventricular fib is the one that kills people.
He says professional medical groups like the American Heart Association and American Academy of Pediatrics now ask doctors to screen student athletes for potential heart conditions like HCM as part of their yearly physical exams. But Dr. Rocky encouraged Pueblo schools to go one step further and buy automated defibrillators.
It's pretty much idiot-proof. I mean, they have these things now in airports. Bystanders have been shown to be real effective. Just open the case. As soon as you turn it on, the voice starts talking to you.
He says the devices will only work if the patient has a shockable heart rhythm. You cannot shock someone by mistake. Every school in District 60 and 70 now has an AED at the ready, and there are 3 of them located around Dutch Clark Stadium.
If there's a chance this is going to happen and we could save a life, how do we justify not doing it? One of the key warning signs for that heart condition that Dr. Rocky mentioned, HCM, is whether you've passed out or felt dizzy like you were going to pass out when you really push yourself hard in practice or a game. If that's the case, you should tell a doctor and look into more testing.